Dr. Linda Park here. Today I want to talk about vitamin D and how it affects so many body systems, starting with the mouth and then proceeding all the way through the entire body. Lower vitamin D in our bodies is associated with higher periodontal disease and cardiovascular disease, brain health, Alzheimer's, affects our muscles and our pancreas, our respiratory system, bones, can affect fertility, also affects our skin. Every body system you can think of is affected by vitamin D. Why is that? Well, that's because every cell in our body has a receptor for vitamin D. That's how important vitamin D is. So there are many deficiencies and reasons for deficiency in vitamin D. The first one I would say is because our lack of exposure to sunlight. And especially I live in Michigan, and we only get great sun for probably 3, maybe 4 months out of the year. And we try to get outside. And yes, we have to be careful about too much sun exposure, but sometimes sunscreen blocks the actual absorption of vitamin D in our bodies and causes a deficiency. So you can be outside all day, and if you've got 50 SPF sunscreen on, then you're not going to get the vitamin D that your body needs. So that is one source of vitamin D. Another one would be eating fish, and you'd have to eat 50 servings of fish to have it be enough vitamin D that your body actually needs. There's a lot of research about it, and what we've discovered is that we are deficient. And you can find out what your vitamin D levels are by having a blood test done and see if you fall in the range of acceptability. And sometimes those ranges can vary person to person, and actually because vitamin D can be stored in fat, someone who is a little bit more overweight is going to store the vitamin D instead of using it the way it should be used in your body. These are things that we've discovered over time. There's a systematic review and meta-analysis of vitamin D and periodontitis. What they discovered is that vitamin D may actually decrease P. gingivalis, that very toxic bacteria that's been found in the brain, that's been found in blood vessels, and found in the gut, wreaking havoc. They've actually found that vitamin D can cause autophagy, or cell death, of those bacteria. So there's just another reason for the effectiveness and the importance of vitamin D. While vitamin D status isn't the only thing or the key thing for overall health and periodontal health, it is an important contributing factor, along with all the other things that we talk about, regular visits and good care of your mouth. There's a website that I found particularly helpful for vitamin D status information and its effects throughout the body, and it's called grassrootshealth.net. They have tons of information and research that explains the importance of vitamin D and why it's important to know your levels and to be tested. So check that out, grassrootshealth.net, and learn a whole lot more about the importance of vitamin D status. So there are several sources of vitamin D, the main one being sunlight, and then some foods like eggs and fish and some various other things. But the biggest factor in status of vitamin D is probably supplementation, because living in the northern hemisphere of the globe, we don't get enough exposure to the sun. And we have winter and we're inside. Many of us have jobs that are inside. Kids are inside more than they should be because of TV viewing and less play outside. And that has really affected, again, this is a modern living thing. So it has affected our vitamin D status, which cascades to periodontal disease and all the other health diseases that we've been talking about. So that's why supplementation is actually really important. And you shouldn't just take vitamin D. You really need to take a supplement that has D3, K2, some zinc, and some magnesium in it. All of those things together are important so that your body can use the vitamin D correctly in the various areas of your body that needs to. Because as I said before, every cell in your body has a vitamin D receptor. How important is that? One very well-rounded supplement that I found for vitamin D, and I personally take a vitamin D supplement myself, is a supplement by Dr. Berg, and it's a D3K2, has zinc and magnesium in it, just the right amounts in combination so that your body can take it and use it. And you don't have to supplement with other things to get that vitamin D to do its job. Because as I've said before, vitamin D receptors are present in every cell of your body. That's how important it is. Thank you so much for taking time to watch this video. I hope you found it helpful and informative for living a healthier life. If you did, hit like and subscribe and wait for more great content.